you. Um, so what we're going to do right now is we're going to get started. So again, we currently have about 10 people on the phone, and we have 8 people logged into the web portion. So again, if you're on the phone but you're not viewing the web portion is kind of where we're going to be showing a lot of the content. So if you're able to click the link that you received along with the phone number to do so, it'll be useful just for you to visualize what we're talking about during the conversation. And again, this is I thank you all for joining us during the first NLAAD Leadership Council call. And this is the first of a series of about 3 calls that we'll have during the course of the next couple months leading up to National Latino AIDS Awareness Day on October 15th. Some general feedback, just in case you haven't been on these calls with us before. This is the way they function. You'll see there's a chat box on the side of your window on your screen. You can use that to communicate. Again, I want to have this be more of a dialogue. So the lines are all currently unmuted, and we'll keep them unmuted throughout the course of the conversation. So feel free to jump in at any point and make a comment or a suggestion or remark about anything that's kind of presented. And just be excited about the way the dialogue is kind of carried out in a minute. Again, part of what we'll be covering is general introductions. I really want everyone to kind of have an understanding of who's part of the Leadership Council. I'm very excited to see the type of strength that each one of you has and experience with National Latino AIDS Awareness Day that could really inform the way the campaign is shaped, not only within your region, but also how it might inform other regions or areas in the way they kind of carry out and utilize resources that we produce from year to year. After that, we'll do a quick feedback as far as some of the key findings that we had from 2013. There was a report that was produced that kind of summarized the implementation of last year. So we're going to talk about some of those key findings. For some of you that were on the first general network call, we presented this information in great detail. But I want to quickly kind of revisit that information, some of those key things that I think would really inform you all knowing to inform the feedback that we can definitely use for this year's campaign. And then quickly kind of talk about the current state of Latinos and HIV to kind of understand how we might be able to then maybe address some of those things within the campaign if we'd like to. And finally, really get to the meat of it where we want to solidify and have your input inform the development of this year's campaign. So again, it's going to be a quick call, yet I'm sure it's going to be a very productive one. And I'm excited to hear the type of input that everyone has to offer based on your given expertise and leadership. So again, my name is Tony. I'm the current National Latino AIDS Awareness Day Program Manager, which is a program that's housed under the Capacity Building Assistance Division at the Latino Commission on AIDS. We historically consider NLAAD a large-scale community mobilization, also / social marketing campaign, being that it's a large collaborative effort amongst partners nationally. So that's kind of the way NLAAD as a program fits within the commission. Again, what I'm going to start doing now is I'm going to have a general introductions just to kind of see who's on the call and everyone kind of get a feel for who's on the call with us. And the way we're going to do that is I'm going to go by region. So as you'll see, there's 8 different regions. We have at least 1 representative from each region. And some regions have more than others. Again, we did, for some areas, we did targeted recruitment, meaning that we actually reached out to most of you individually and asked you to be part of the Leadership Council, just because we've historically worked with you either through the Commission's partnerships or some other means, and we really felt that you'd be a great asset to the way the campaign's kind of implemented. So what I'm going to do now is I'm going to start by region, and for those people that confirm to be part of the Leadership Council but aren't on the call with us, I'll make sure to give you their names so you kind of have a feel of who else is part of the Leadership Council that's in your region that you might know. So I'm going to start over here with the left side, the West Coast. So if anyone's from the West Coast, meaning these 3 states that are shown on the screen here, please feel free to jump in and introduce yourself. Give us your name, give us your agency or who you represent, and also let's make this fun, whether you're following the World Cup, and if you are, who you're rooting for. So I'll start again. My name is Tony. I'm the Latino Commission on AIDS, current Program Manager for National Latino AIDS Awareness Day. And I've been following the World Cup, and I'm rooting for USA and also Mexico. So anyone can feel free to jump in from the West Coast or from the West region. Anyone? If there isn't anyone, I can start introducing people that weren't able to make the call today. We have Joshua Ferrer, who's with Cascade AIDS Project over in Portland, Oregon. We also have Rosita Castillo with Planned Parenthood of Southern Nevada in Las Vegas. And we also have Chanel Flores with the California Department of Public Health Office of AIDS in Sacramento. Is there anyone else from the West Coast that's on the call with us? If not, then we'll move on to the next region, which is the Mountain Region. Anyone from the Mountain Region on the call?
Yes, this is Edwin Espinel from the Utah Department of Health.
Hey Edwin, how are you?
Good. It's good to be here. And yes, I am following the cup, and Ecuador is going to kick some French butt this afternoon.
That's right, you guys are playing in an hour, no?
Well, actually, in about 15 minutes, I'll be leaving the conference. Oh, just kidding.
I feel ya.
Yes, I'm wearing the T-shirt and everything.
Wonderful, I bet you are.
Yes.
Great, so good luck with that one. Anyone else on the call from the Mountain Region? I think you might be the lone soldier here from the Mountain Region, Edwin, so thanks for joining us. What about the Southwest?
This is Jorge Salazar from El Paso, Texas.
El Paso,
happy to be with you all, representing Centro de Salud Familiar La Fe and the La Fe Care Center, which is our HIV-specific federally qualified health center. And as far as the cup, the great thing about being in El Paso is I can actually have one boot in Texas and one boot in Mexico. So I'm rooting both teams, and I'll do the skip the minute one or the other team wins. So
it's all about the bandwagon, huh?
There you go.
I love it. Thanks for joining us, Jorge.
Seguro.
What about anyone from the Central Midwest?
Hello, everyone. This is Jorge Sestu, and I am with the Puerto Rican Cultural Center Vidacida, and I am not following the World Cup this year.
You're not?
No.
That's okay. No problem. Great, thanks for joining. What about anyone in the Southeast?
Hi, this is Oscar Salinas.
Yeah, Oscar, how are you?
Yeah, I'm all right. Here in New Orleans with Delta AETC, and I'm following the World Cup. Well, I'm from Honduras, and sadly, we are almost out. We're about to play this afternoon, but I won't be able to watch the game. But I'm enjoying. It's a good World Cup, a lot of scores, good players, good strategies. So I'm enjoying that.
Definitely. I saw that game you guys played with Ecuador a couple of days ago.
Yeah. We definitely did kind of bad with that.
It happens.
It happens, yes.
Anyone else?
Good afternoon. This is Sergio Parfan, also from Louisiana Latino Health Coalition. And I guess just from Mexico.
From Mexico? Wonderful, Sergio. Thank you for joining us today.
Sorry, Oscar.
Yeah, you don't even like sports, man. Come on.
He just called you out.
I know, but they ask.
You're
absolutely
sure. Thanks for being here, man.
Okay.
Wonderful. Anyone else? What about anyone from the Northeast? I know we have a couple people from the Northeast.
You?
Hello?
Hello, yeah, this is Fernando Morales from the Northeast. I'm calling from Latino Community Services in Hartford, Connecticut.
Hey, Fernando, how are you?
I'm good. And a couple of things. Yes, I am following the World Cup, Mexico all the way, big time. And I also want to give a shout out to my friend there in El Paso. That's my hometown, and I used to work at La Fe Clinic.
Oh, nice! I love it. Good
so
stuff.
Great.
Sí, man, La Fe is everywhere. This is Jorge Salazar from La Fe. Good seeing you, hermano.
Oh, igualmente, claro.
And this is Alfredo.
Anyone else from the Northeast?
Yeah, Alfredo Hernandez from Boston, Massachusetts. And I'm rooting, of course, from Mexico and USA. And I am actually surprised that this year, for the first time, I think it's been a lot of people really into the football, soccer, even though it was for us Latinos before just nobody was understanding what was going on around the world. So
Yeah,
it's good to see that.
absolutely.
And a shout out to my friend over at the Latino Community Services. We used to provide some capacity building assistance to them. And I'll be chatting with you soon because I wanted to figure out how can we expand our collaboration and partnership for NLAAD this year.
That's great. Looking forward to that.
Great.
Great, beautiful thing, already networking. I love it. Is there anyone else on the call that we haven't introduced? I want to particularly introduce someone right now who's part of a great support to us here at the Commission and specifically with National Latino AIDS Awareness Day. We have Garrett Jackson, who's with PennGood. He's our subcontractor with CDC, who really helps us as far as the way we utilize some of the resources that are available and the way the campaign's developed. So, Garrett, do you want to introduce yourself real quick?
Yes, thank you, Tony. First of all, USA all the way. I'm waiting on Thursday's big day.
Yeah.
We'll see how we play. I'm a big football fan, been playing since I was 8 years old, so this is the World Cup is what it's all about right now, and I think I am probably pulling it up on my mobile device and putting it on mute. But Tony, I won't miss taking down any of the notes, I promise.
Wonderful. And thanks for doing that, by the way.
Yeah, no, absolutely. Delighted to be working with the team and very excited about the great work that NLAAD has been doing in the number of years. This is unfortunately only my first time working with NLAAD in particular, but I certainly look forward to many more to come. So I will be listening very closely. I'll be taking down some good notes and being as supportive as I can and the PennGood team can for NLAAD as we approach the day.
Great. Thank you so much again. Is there anyone on the call that we haven't had a chance to speak to yet that wants to introduce themselves? I know we haven't gotten everyone. I see 10 people that are dialed in. I guess we have some ghost listeners, huh? That's fine. I guess someone wants to infiltrate our system here, but we'll let them do that. If anyone else jumps in at any point, we'll let them kind of talk and introduce themselves in a minute. So again, thank you all for joining us today. There's a couple key things that we want to kind of talk about before we get started in the meat of the thing, but the general role of the Leadership Council, for those of us that were part of it last year, and when we say the role of the Leadership Council, it's pretty much up to you to decide how far you want to take your role, given your respective region or, your national expertise. But kind of what we expect as far as members of the Leadership Council is to help us identify local issues that we can kind of bring to a national platform. Part of what we do a lot of recently is we've worked very collaboratively with our partners in the Deep South. We have two staff members within the Commission that are stationed there, and that kind of came about from really being reached out to as far as requiring support through capacity building. And that's kind of, for those of you that haven't heard about our Latino Deep South project, that's kind of where that came about. So we have two staff members that are based in North Carolina, and that's kind of an example of which we kind of, how we would like to generally support most regions in the way they kind of carry out the way things are done in the field, right? So that's another way, one of the ways in which we ask Leadership Council members to kind of be involved, is really help us identify some of those local issues that we can bring to a national platform and provide support with in some way or another. Another way in which we can see the Leadership Council serving its purpose is through the input and development of NLAAD. The key thing right here, I think, a lot of the great things that we saw come from last year's campaign came from some of the input we got from Leadership Council members, including the theme and things like this, and some of the content that was developed was very useful in the way the campaign was carried out. So again, we constantly have an ear to the ground as far as the input that's provided, so that we can take that information and really make sure that what you need is being carried out, and what you feel isn't, we can try to address in some way or another. Again, maintaining strong partnerships not only with each other and across each other's expertise, and also within the network of Leadership Council members, but also with helping us develop stronger relationships with the campaign with other partners that are local. And this is a way in which we kind of heard from the General Network during the first General Network call that a lot of people wanted support with. They wanted to find out how could they engage traditional partners and also non-traditional partners, business and other things like this. We definitely would like you all to feel like we're here to support that. So if you feel like there's anything that we could do to help you do that, by all means, please let us know that. And it could be something as painless as hosting a very specific regional conference call where we can kind of moderate that conversation about how Latino health issues are happening in your particular region, or even have a face-to-face meeting where we can actually host somewhat of a town hall meeting and have some of this information shared with traditional and non-traditional partners, key stakeholders and things like this to really help with the way things are carried out. And generally the way in which we do this is through our capacity building assistance division. So we would be more than happy to have that happen, just to make sure that whatever event that's being planned or whatever type of strategy is being executed regionally is the most effective as possible. Are there any questions about that or anything that you think that the Leadership Council can kind of serve a purpose that would really help with what's going on locally with Latinos and HIV, or just specifically with NLAAD 2?
This is Stephen Vargas.
Hey, Stephen. I didn't hear you earlier. How are you?
I just got out of another meeting. We have a mass testing event planned over here. I wanted to know, would there be able to have a webinar on the outcomes from the street intercepts for the Leadership Council?
I'm glad you said that, because part of what I'm going to talk about right now is that information. And I think you're on the call. We try to present that in a little more detail during the general network call. But are you speaking to have that information presented to whom?
Well, I was wondering if it's something that could be done for instance, a webinar like this with the Leadership Council for NLAAD or other partners as well, to the larger body that participate in the NLAAD planning calls once you start rolling those out, so people can get an idea of what seems to be working or not working in their areas.
Gotcha. Definitely. I mean, one of the benefits, since you're bringing that up, let me start presenting some of that information now, so that way people can kind of have an idea of what you're talking about, just in case people don't have a keen understanding of what we're talking about when we're mentioning the report. But the report is something that we produce every year that kind of summarizes the way the campaign was implemented the previous year. So we really collect a lot of data from different sources, two of those sources being the street intercept surveys. And the way those are carried out is those are kind of used to measure people's knowledge or understanding of the campaign, whether they heard about it or not, and kind of what they did about it as a result of it. So we partner with organizations, and one of the partners that we had last year was Stephen Vargas, who helped us collect street intercept surveys locally, and this then informs the way this report is crafted. Another way in which the information is utilized or this report is produced is through an online partner survey, which I think some of you guys might have filled out too. And that's more to do with feedback on how we can better organize National Latino AIDS Awareness Day as an organizer to make it more of a seamless process for you. So there's things that we're kind of doing and a lot of information pieces that we're gathering to produce this report. And if you haven't had a chance to read this report, I know I emailed that to the general network, but I'll make sure to email it directly to Leadership Council members. And just to give you guys an understanding, there's about 20 some odd Leadership Council members, so we have about half of them on the call with us today. A good number of them let me know that they weren't able to be on this call today, but they wanted the notes, so I'll make sure to send those out again, just for you guys to have as well. But I'll make sure to send this report out after we kind of talk about it again, just so you can kind of read in great detail. And I really encourage you to read the report, because I really think it gives us a general understanding beyond what we see from CDC and the federal government as far as what's going on with Latinos and HIV. It really gives us a top-down kind of visual from the campaign's perspective as far as what's happening with Latinos and HIV. So here you'll see a timeline of the way last year was kind of developed, everything from the announcement of the theme and the first Leadership Council call to the actual end piece, which was the closing feedback survey that was posted online. And so I'm going to start presenting some of the key findings I think are very useful, which is generally, these are the type of events that most partners hosted. You'll see the majority of partners hosted a health fair at about 51%. We also have partners who are doing information dissemination, a cultural event, a public service announcement, general discussion, a skit, a press conference, and a candlelight vigil. So again, these are very innovative ways in which different partners have engaged in the held events for National Latino AIDS Awareness Day. They don't always have to be testing events, but we strongly encourage to have some sort of testing piece to it. And again, this information was gathered from the online surveys. And you'll see that about the large majority of them were community-based organizations that filled out that survey, followed by clinic-based, health departments, academic institutions, and others, with a total of about 129 online surveys that were filled out. There were about 148 events that were registered. Mind you, expect this number to be larger, but these were only the events that were registered on the website, which is the only information that we were able to capture. And these 148 events were organized by about 102 organizations, and I expect this number to be larger, just because what we pushed for organizations to do is to have a large collaborative effort. So I foresee a lot of organizations that didn't register because they might have let the person that was spearheading it be the one that was registering the events on the website. So I expect there was a larger number of organizations that were involved that weren't necessarily registered on the website, which is something we're trying to address with this year's registration process. And there were 4,000 testing kits. Again, we secure about a large number of testing kits that are donated through Always for Technology, and we share these testing kits with events that are happening locally with organizations that have testing as part of their NLAAD events. So this is a great asset that we have available for anyone or any organization that looks to have testing available at the local NLAAD event. And going back to those street intercept surveys that I talked about, again, it's up to local partners to decide whether they want to be involved with being part of this process. Of course, as an agency, we don't have the manpower, nor do we have the resources to go to every single city across the country and territories, but we do have strong partnerships and collaborations with organizations that are able to support with collecting street intercept surveys, which really helps inform how people are hearing about the campaign and how they're responding to it. So if your city isn't listed here, but you really want or feel that your information would be useful to have for you in-house, we can then collaborate with you to have this information available and kind of provide you with the resources to carry this out. But all in all, we had about 738 street intercept surveys that were collected in these cities. And the cities were Atlanta, D.C., El Paso, Houston, New York, Santa Barbara, and St. Paul. And the beautiful thing about these cities is that they all represent very diverse sectors of the Latino community. So you can imagine how somewhere like New York City would really be reflective of a population, a Latino population that's very different from Santa Barbara. And this is the type of information that we like to see across the data that's collected, just because I think it really does speak to different segments of the Latino community differently, and we really take that to heart. And some of the findings that we found from the website was that we have a campaign kit, and what we saw people downloading the most were these 3 fact sheets. So again, Latinos and HIV/AIDS, which was the main one, followed by HIV and Latino youth, and the third one was HIV/AIDS and Latino men who have sex with men. And during the course of NLAAD, since we launched a new website last year, there was about a 53% increase in visits during that time. So again, the website is something that's a continuous improvement, and I know some partners had a lot of obstacles with accessing some of the resources last year, which we're taking that information to kind of help us address how we can better address those issues this year and prevent them from happening in a more constructive way. So, are there any questions so far before I keep going? Anything that I've talked about so far that particularly speaks to you, or anything that you want more clarification on?
No, I'm good.
Okay, beautiful, beautiful. So part of what we gathered from the street intercept surveys was what people did if they heard about the campaign, right? If they heard about NLAAD, that's great, but what would you do in response to that? A good number of people that heard about the campaign, about 23% of them took an HIV test, which is a beautiful thing to see, just because historically with NLAAD we've seen from partners that collect this information that there's about a 3% positivity rate, which is letting us know that compared to nationally, that's a pretty good marker, considering that the national average is about 1.5%. So to say we have about a 3% positivity rate, and we have about 23 people that heard about NLAAD because of NLAAD took the test, is really continuing to let us know that we're doing what we're doing in the right way. And other things that people did were, talk about HIV with friends, attend an NLAAD event, talk about HIV with family, increase condom use, talk about HIV with a partner, and talk about HIV with the doctor. And again, you'll see that there's talk happening a lot, which is a beautiful thing, because last year's theme, for those of you that remember, was commit to speak. So we really wanted to make sure that people had some sort of talking component as a response to the campaign, which I think we generally saw, given these markers here. Another thing we saw that we collected was the type of referrals people were given or offered based on their status after they were took the test, or maybe they came in and let the other person know or the agency know what their HIV status was, and the type of referrals that they sought out after that. The larger majority for HIV-negative individuals were further STD clinic referrals, but we also see a large number of substance use, needle exchange, and this specifically for HIV-negative. For HIV-positive, we see a larger number of health insurance, which is a key piece that we'll talk about in a minute, because that really speaks to linkage to care, which is something that as a greater population, we have a lot of work to do, just because there's a lot of barriers there. Mental health, case management, and referrals to medical providers. Is any of this information particularly alarming, or do you think it's reflective of what you saw with your campaign previously, or with your events locally, as far as needs?
I think for Connecticut, what I'm finding, it goes in line with the STD referrals, because here in Connecticut we have an increase of gonorrhea and syphilis. And surprisingly, actually, for the last 2 years, there's been an increase within the young MSM community. So that struck me right now.
So you're saying that's specific to the MSM, the YMSM population, right?
Yeah,
the Latino YMSM population?
Yeah, we're seeing an increase in this area here throughout the state. And these are incredible statistics right here.
Tony?
Yes.
This is Edwin. I have a couple questions, and I want to concentrate on your previous slide about the HIV testing. Do you have any solid numbers as to what the positivity rate is on NLAAD right now, or the number that you mentioned is more of your experience, or you're inferring that number from national data?
That's information specific to National Latino AIDS Awareness Day, and the way that information is collected, and that's generally what we see from year to year. So this is kind of where the stipulation with the data comes into play, where we rely on partners that host events to fill out that survey online, which is why you'll notice that when it comes to the end of National Latino AIDS Awareness Day, and you guys might have again received some of my constant emails, is that I'm constantly pressing organizations that registered events to fill out that survey, because that really lets us know how that event went, specifically if you had testing at your event. So we rely on the information that partners give us based on the events that they held, especially those partners that requested testing kits from us to fill that out. So based on that information is where we're collecting that positivity rate. That is something that's highlighted every year, and it's highlighted in this year's report. So if you want to read more extensively about what those numbers look like, I encourage you to do that by reading the report. And again, it's not too lengthy of a report. It's very visually pleasing, and it's very easy to follow. But that's where that 3% generally comes from, which is what we've met from year to year.
Okay, and now let me double check on that again. And I definitely have failed to read the report. And I tried to get on the webpage today, and I see that there is only the presentation that you made on that report. But I have not seen the document, so I don't know whether you can. If I email you later, maybe you can forward it to me.
I'll make sure to send it to everyone on this call right now.
That'd be great. Now, a follow-up question on the testing. testing is done with a rapid test. So the result is preliminary positive. Is your result preliminary positive results, or is it a confirmed with the laboratory conventional NLAAD test or PCR? How are those 3% positivity rate confirmed cases, or they are just preliminary results?
Those are preliminary results. And another thing to note is it doesn't capture whether that person was a known positive.
Okay. Because that it seems to me that, and I know every jurisdiction has different policies on follow-up.
Yes.
But when you are making those referrals, one of the major referrals is linkage to care. Well, without having confirmed the results, linkage to care is very difficult to prove. And I was wondering, because from my end, and perhaps I'm speaking from my end, I see how CDC is putting more and more emphasis on identifying positives not previously diagnosed, and then link them to care.
Mm-hmm.
And that means that there has to be a confirmatory test in between. But I don't see that. And I don't know how far you will take maybe the survey next year to actually have everyone as a commitment to receiving the testing kit or doing an event to actually do the follow-up, the due diligence to follow up and find out whether the client was confirmed and then linked to care.
And that's an important point you make there, and I'm glad you mentioned that. And again, we generally rely on partners' good graces to fill out that survey, but I think definitely prompting those partners, especially the ones that solicit testing kits, to kind of commit to filling out that survey would be very informative. And I think some of those things that you're bringing up as far as the confirmatory and linkage to care piece wouldn't be impossible to collect, especially if we're talking about those people that had a preliminary positive, just because the survey does come out around January, February, which by that time would have fit that 3-month period by when that person should have been linked to care in order to meet that marker. So I'm glad you brought that up, and it's something that I'll definitely bring up with our research and evaluation department to see if they can include that piece in next year's survey. So I'm diligently making notes as you guys are making that comment. So thank you so much, everyone, for that feedback. That's very good feedback.
Thank you. And just one more thing, and I don't want to take that much time, but when it comes to these referrals, and I think that is great, especially if we are showing that the type of referrals that our community needs. I think that that is very crucial. One piece that I am wondering is also about the risk behaviors that we are collecting from those individuals that we test under NLAAD. More and more jurisdictions are targeting their efforts to a specific population. And one of the things that I always point out is that our community many times may not disclose necessarily all the risk behaviors, but one of the things that it is important to point out is that they are first-time testers. And as first-time testers, I think that they should be included in reports because that is a major, no quality, but a major indicator in our community.
Oh, definitely. I think it's something that I've personally seen a lot with organizations that I've been working with recently as far as how they're screening their clients as far as risk behaviors. And especially during a time when a lot of funders are requiring certain agencies to meet a positivity rate on top of having a certain number of people tested, which is then forcing people to make sure that they're prioritizing certain populations and really making sure that the populations that they're reaching out to or providing testing to are really high risk. So I think to kind of prompt organizations or partners to do this would be very useful, and I think it could potentially lend itself to maybe a follow-up general webinar for partners to attend where we talk about what does testing high-risk population look like and how that information could potentially be gathered. So that's a very good point there.
Thank you.
Wonderful. this is information I've been wanting to hear. Great, thank you so much. So with that said, I'm already hearing a lot of feedback. But does anyone have, and the way I want to structure this feedback is, and I want you also to think about regionally whether there's any particular need that you think the campaign can support with you all addressing. So whether you feel like the campaign, and you can think about how your NLAAD event went last year, how you think NLAAD was executed at the regional level, or any type of logistic information that you think could have been enhanced last year to make your NLAAD experience a little easier to deal with. So this is any time to provide any general feedback about the campaign. Trust me, I won't be hurt. If anything, I really want to lend my ear to listen to what type of information you have to offer as far as what your experience with NLAAD was last year.
This is Alfredo, Tony. I don't want to complain or anything because there's nothing absolutely to complain. I think the Latino Commission and NLAAD has managed this campaign for a long time, very well orchestrated and very well organized. You know that I've been involved as a community-based service organization in the past and as a SIVA provider later, and now as a member of council. And all I can say is every year is absolutely very well orchestrated and very well done. And the support you give us, it's been absolutely wonderful. And I'm speaking from Massachusetts and Connecticut and a couple of other places, but I'm sure it will be different from other places as well.
Great, thank you so much for that feedback. And you have a big smile on my face right now. Thank you, Alfredo. I have Stephen right now that's in the chat box. She wrote, I think we could get the street survey just a bit earlier. A week or two could help with getting more filled out. And again, Stephen, the amount of effort you put into collecting that information was invaluable. It really does inform what we know the community general sentiments are and the way they kind of have felt about the campaign. So we've already started making strides as far as our work plan goes to make sure that those are available to be delivered out by the end of August. So again, those come with incentives for people to fill out, and also the surveys themselves and general instructions. And if anyone else is interested in kind of orchestrating the collection of street intercept surveys, it's really an informative process and really does potentially help with the way you orchestrate your local events if you take part in that, and also the way we see the campaign's implementation from year to year. So again, taking what we see is happening locally within your area, and incorporating that within the report that then ultimately informs the development of the campaign. So I'll make sure to take note of that. The research and evaluation team is already working and orchestrating those improvements from happening this year. So we're trying to alleviate having to send that out last minute like we did last year. So again, thank you for that comment. That's very well received.
This is Stephen again. So one of the other things I wanted to bring up was how really helpful it was to be able to encourage agencies to secure some of the rapid testing mechanisms. One of the things we're seeing, I think it was kind of spoken about a little bit earlier, that because of targeted testing, a lot of agencies with whom we normally collaborate can only test very specific populations, and they get more specific, it seems, every year. And so that sometimes can be a barrier towards effective collaborations, trying to find, okay, the missing pieces in the puzzle, and when you're trying to test the general population. You might have someone available to test youth, might have someone available to test other folks, substance users, but it's kind of hard to find folks that will test 40-year-old heterosexual Latinos and up. And so those quick rapid testing kits really helped out a lot, because with that we were able to share with the agencies that the test that you get for your targeting populations, you can keep for your targeting populations, but if someone comes to your table that does not meet that targeting population, we can use one of these other rapid tests for them, and therefore you're not jeopardizing any of those other contracts or any of that other testing stuff. So that really helps a lot, and I'm hoping that we can move forward with doing that again this year. I know we've been doing it for the last several years, making tests like that available, because that does help in forming partnerships between agencies. Definitely wonderful. And I think one of the benefits that we've seen, especially through the development of this year's report, is that we're actually very
excited to see the type of knowledge based on our partners that they have as far as the National HIV/AIDS Strategy, high impact prevention, and what that looks like. Compared to, because we also have traditional partners that have been involved with the NLAAD fill-out survey, and also agencies that weren't involved with the NLAAD fill-out as well. And we kind of compared those two numbers. We saw that the people that were involved with NLAAD generally had a higher understanding of the National HIV/AIDS Strategy, which kind of really speaks to those pieces of priority populations. So I think it really lends itself to what both Stephen and Edwin are saying as far as what those numbers look like and why these populations are priorities, and also how we can definitely potentially screen some of those other populations that might not be priorities to assess their risk behaviors, and still give them the opportunity to get tested to find out whether that's something that should be considered. And again, that's tied into the entire referral piece too. So definitely, I think both of you guys brought a very good point to both of those sides. So thank you for that. Thank you.
Tony, this is Jorge in Chicago. And
hey, Jorge.
From my perspective, just from the name of the event every year, the National Latino AIDS Awareness Day, I know that the focus is HIV testing, and we're testing individuals to let them know if they're HIV positive or not, and not necessarily letting them know if they have AIDS. And going back to the idea of having this name of the event as a national event, it's like I was thinking here, that maybe we really need to put a campaign where we separate like the different layers, like the layers for HIV negatives, and possibly, really put a picture out there as to what's really happening with some of the mandates with the National HIV and AIDS Strategy and CDC for high impact prevention, and how's that really affecting our communities. And also the second layer, how are organizations really dealing with HIV positives and all of the supportive services that exist, and also painting a picture as to how the effects of the Affordable Care Act and other things that are taking place now is really affecting our community.
And I'm glad you said that, because we've already had internal conversations. And again, part of what we want to do as a campaign is, again, work very closely with partners and making sure they have the capacity and understanding of what's going on nationally with Latinos and HIV to be able to carry out effective campaigns or local events. So part of what's happening here is, we're creating change locally with the community, but we're also enhancing our partners' capacity to work well with Latinos, because some of these partners don't historically work with Latinos or aren't funded to work directly with Latinos. So the fact that we're working with partners to kind of understand what's happening with them in a different way and bring in some of those things you just brought up, Jorge, is very important. So those are very valid points. Thank you so much for that, for reaffirming that. And so with that said, I think it really lends itself exactly to what we're going to talk about right now, which is the current state of Latinos and HIV. And part of what I'm going to present or kind of talk about is that if you guys haven't had it, how many of you guys, there's a function on your screen. Have any of you guys read the National HIV Prevention Progress Report that came out last year? And you can raise your hand just by so I can kind of understand to see if anyone here has read it or not. Great, so I see a couple of people raise their hand. This is a very informative report, just because this report lets us know, as far as the National HIV/AIDS Strategy goes, whether we're meeting our targeted numbers for each goal and each objective. So it broke it down based on the goal. So there's 3 main goals, and then each individual objective under that goal. One thing that I think we should all note, especially considering that we're part of National Latino AIDS Awareness Day, is that there's key populations that aren't necessarily meeting the marker. And you identify those with the red X here. And those are specifically when it comes to increased linkage to care, to HIV medical care among racial ethnic groups. We're not meeting that marker with Hispanic Latinos. And also under reduced new HIV infections among groups at increased risk by 25%. We're not meeting that marker with Hispanic Latinos again. So it lets us know that there's still a lot of work to be done as far as what we need to do, and then we can potentially incorporate within the campaign this year. So again, when you're talking specifically about new HIV infections among Hispanic Latinos, we're expected to hit a certain goal by 2015, and we're not meeting that marker so far to potentially reach that goal since the National HIV Strategy first was rolled out in 2010. So again, most of us know this number where we see, Latinos make up about 16% of the U.S. population, yet there's 21% of new HIV infections. Overall, new HIV infections remain fairly stable, which is letting us know again that we're not seeing a decrease here. And among Hispanic Latinos, the 2010 target was not met because there were more new infections in the year compared to 2006 baseline. And the 2006 baseline is what informed the National HIV Strategy. Among Hispanic Latinos, the majority of new infections are attributed to male-to-male sexual contact. New infections increased 19% among Latino MSM, including Hispanic Latino MSM and intravenous drug users compared to 2008. When comparing 2008 to 2010, a decline among IDUs and heterosexuals. So we'll see that there's a decline amongst intravenous drug users and heterosexuals, but a general increase among men who have sex with men and men who have sex with men and are also intravenous drug users. On a lighter note, new HIV infections are higher amongst Hispanic Latino males than females across all groups. Compared to 2008, the largest increase in new infections occurred among Hispanic Latino males aged 13 to 24. Again, this kind of reflects what we see nationally when it comes to YMSM, when it comes to a larger number of youth becoming recently infected. Is any of this information particularly alarming, or do you think it kind of reflects what's happening regionally for you?
Yeah.
Who's this?
This is Fernando. I'm sorry. Yeah.
Hey, Fernando.
How are you? It's reflective of what's happening here in our state in Connecticut. So, yeah, this is not. I'm familiar with this.
Yeah, and I'm not surprised. I mean, we recently had, and Stephen Vargas said the same in Houston. So it definitely lets us know where there's area for particular focus. And again, maybe this is something we want to consider when we're thinking about the formulation of the campaign this year, whether this is something we want to address. But also, I mean, we've kind of seen it happen and happening with different organizations and different forums we've had across the country where we do see this is the case, which is then reaffirming the fact that certain populations are being impacted differently than others, and the reason why certain resources are being allocated towards specific populations. And going back to that risk behavior piece that was talked about earlier, and balancing that with some of those other populations that oftentimes aren't focused on that still need to be tested. Are there any other comments about these new HIV infections and kind of not meeting this marker or objective through the National HIV Strategy?
Yeah, this is Jorge Salazar, and we just completed the needs assessment that is done every 2 years in order to complete the statewide HIV plan. And Hispanic youth in that age bracket in MSM are, in fact, one of the high priorities, which should impact the messaging, although I know we have targeted youth before, but sending the message to youth that now there's multiple ways where they can become informed and get information on linkage to care, which in our cascade of services is one of the gaps. Latinos are tested later and enter care later.
Yeah.
So I think those are some of the themes. I also wanted to put on the table that as of last year, the health department here in El Paso has headed up an initiative called Community Mobilization that brings in non-traditional partners to help us spread the word around HIV, everything from testing to linkage to care. And as the representative to that group that has really grown and taken momentum, I want to take this campaign to them and represent the Hispanic and Latino AIDS awareness message once we develop it, and use that mechanism to get to some of the populations that I think we still need to penetrate.
Definitely, and I'm glad you brought that up, Jorge. I remember I was actually there during one of the meetings you guys had during the summertime So I'm excited to hear that's still going on. That's kind of thriving. I know the El Paso Department of Health is a strong ally and partner when it comes to National Latino AIDS Awareness Day, so I'm glad that you're involved on this end, in the Leadership Council end, that really will then in turn impact the way they execute and develop the campaign. And you have that means to kind of present that in this community forum, mobilization piece. So very well listened to on our end. Thanks for that. And like you mentioned a minute ago, that linkage to care piece is something that we're not necessarily meeting when it comes to Latinos either. In 2011, about 4 of 5 HIV diagnosis Hispanic Latinos were linked to HIV medical care within 3 months. So again, this is the way in which we're measuring whether someone's linked to care. So 1 in 5 people that were diagnosed were not linked to care within 3 months of diagnoses. So we're not seeing us meet this marker for Latinos. The percentage of HIV diagnosed Hispanic Latinos were linked to HIV medical care was fairly stable from 2009 to 2011. The revised 2011 target was not met. More progress will be needed in order to achieve the revised 2015 goal of 85%. So we're at about 81, 82% right now since it was measured in 2011, but we're slated to kind of see an 85% number when it comes to linkage to care. So again, whether this is something we can address through the campaign is something that we're considering, and kind of ties in with some of the pieces we had for NLAAD this year. Are there any, because I know we talked about somewhat extensively Latinos and linkage to care and why that's important, but does anyone have anything else to add about what they've kind of seen or their experience nationally or locally as far as linkage to care goes with Latinos?
Well, this is Stephen in Houston. And not really linkage to care, because we're seeing the same exact thing here in Houston when we develop our own local Houston treatment cascades. But I was wondering if folks are seeing what we're seeing here as well when it comes to the whole maintenance and care and getting to viral suppression. We see that Latinos, even though we're least likely to know our HIV status and therefore also least likely to be linked to care, but for those who do know their HIV status and are positive, that they are better than some of the other races at maintaining care and getting to viral suppression. So I'm wondering if folks are seeing that in Chicago and other areas as well.
And I know certain regions have the resources to develop ethnic or racial specific cascades, and I know other regions don't necessarily have the resources to do that. But I'm curious too. Has anyone seen within the regions where they're actually meeting the marker or surpassing it as far as linkage to care goes or retention? And that silence is a little scary, but I think it definitely lends itself to an area in which we can continue to do some more work. If not outside of the campaign as well, ways in which we can support each other, in creative ways in which we can kind of address this. But you bring up a very good point that and I'm glad to hear, Stephen, that you guys are marking that or noting that information locally. So with those things kind of mentioned, both the feedback that's been presented so far as the campaign goes last year and the current state of Latinos and HIV, I wanted to kind of start talking about the theme discussion. So kind of knowing that we've discussed what we've discussed so far, how might this inform this year's theme? Part of what if you guys remember, the theme last year was Commit to Speak, which again came from data that was collected from the previous year, where we saw that the majority of people heard about the campaign, or a good number heard about it through word of mouth. And on top of that, word of mouth was actually the piece that got people to do something about the campaign after hearing about it. So this word of mouth piece is something that we wanted to keep as far as a theme goes, and also a call to action as far as getting people to do something about it, because oftentimes the theme has been something very abstract, where it's been like open your eyes or things like save a life. But what we wanted to do last year was have it be something more concrete and action-driven, so which is where we kind of came up with Commit to Speak. And that commit part came through conversations that we had in the Leadership Council last year, where this compromiso, commitment, comprometete, these type of words were something that came up a lot. in dialogue that we've had. So with that said, we kind of, in discussions internally with the Leadership Council last year, we came up with this theme, Commit to Speak, where we showcased 3 people or figures from the Latino community, one of them being a doctor, another being a youth, and another being a pastor. So we kind of asked them why they commit to speak, and these are the type of responses we had. And again, we had from the doctor, Dr. Calderon, who said, "I want to see a world without HIV during my lifetime." That's what she committed to speak. And again, these are in English and Spanish. The youth, who is also now a staff member here at the Commission, Ruben, said, "To protect the people I love." And the father said, he commits to speak because it affects our communities. So in considering that we still wanted to maintain some sort of strong action-driven theme, rather than having it be something more abstract than like we've had previous years. So another thing that we were considering is that if you notice, the theme changes drastically from year to year, which I think sometimes can be confusing for community members when they're trying to grasp what that action piece could be beyond just getting tested. So what we were thinking of doing this year, rather than changing the theme completely, keep part of the same theme intact and modifying it slightly. So what we were thinking of doing is, rather than asking people to commit to speak, is asking them plainly to commit. So having that piece of commit to blank optional for them to kind of fill in. So some of the ways in which this can kind of be abstract and really customized to the individual is that someone can commit to learn about HIV or learn about transmission, or they can commit to know their status, so commit to learn my status. Or things like commit to treatment, right? If someone's already positive, what's something that they could do to make sure they're committed to addressing HIV/AIDS awareness amongst the Latino community. And you can start seeing how some of these pieces might fit into some of the gaps that were discussed with the data that was presented, as far as new infections and also linkage to care. Some of those things might easily lend themselves to this open piece right here of the open space, right? So with that said, what do you guys think about keeping it general like that, asking people to maintain the strong, because we understand that the commitment piece is something that really speaks to Latinos because of the communalistic factor that a lot of Latinos come from, or they're more driven by a communal impact, more rather than an individualistic one. So having some sort of commitment piece to it, I think would be beneficial and help with having sustained change. Alfredo said commit to end AIDS, so that's definitely, and that's part of what I want to start doing. So Alfredo, thank you for doing that. Is I want to start asking people to give in that, fill in the blank. So Alfredo's already given us commit to end AIDS or commit to make AIDS history. So again, those are very good ones, and what we want to do is provide options for people to kind of fill in those blanks for them. So it wouldn't necessarily mean that we would select one particular one, but having people see that there's different things and different ways they can commit to increase awareness or commit to ending the disparity in which HIV affects the Latino community. So before we get into that piece and start filling in those blanks with other ideas that we can kind of get for, what do you guys think about keeping that commit piece there? Do you guys think that's something that would help as the theme goes?
Hey Tony, this is Garrett. From a communications perspective, I think when you say commit to, you're speaking to someone. When you say I commit to, that's a bit more introspective, and that's taking a more kind of personal stance. So I guess really the question is, would this, let's say, poster, for instance, would that be me reading that person is committing to getting tested, or that person is speaking to me saying I should commit to? They're saying commit to Garrett, commit to getting tested. Garrett, commit to, telling your neighbor to go get tested, or am I?
Yeah, I agree. I think it's very encouraging, and also make that take a stand like you said. I totally agree. This is Alfredo, by the way.
What would be the word in Spanish for commit? What would be the the one we're going to be using?
So last year was commit to speak. So it would be comprométete, but like I think Gary brings up a good point right here, where it could be multiple ways in which this is conveyed, right? So the theme can be commit to blank, but if we're showing someone role modeling this commitment, it could be someone on a poster that could potentially say, "I commit to blank," so you can kind of see how that's different from asking someone commit to blank versus I commit to. So that's a very good point, Garrett. Thank you for that.
Sure thing.
I think it also could be, I see where you're going with this, which is very interesting. I think it could be good to have it as a slogan of, to end AIDS, I commit to, and we can leave it in blank, and that whoever is reading it will say what they are committing to. That's just a thought.
So I like that. So to end AIDS, I commit to, and then blank?
Exactly. Because that way, I mean, I cannot imagine the number of reasons or words people can put in there, which will be a very good thing to see.
Great.
I mean,
I like
Tony,
that. I like that.
I could even imagine, Tony. I could even imagine a almost kind of a billboard style poster that you would have maybe in a school, and it would have a bunch of let's say Post-its as the blank, and each person could take the Post-it and write their word, and
that could be very powerful. And
I'm glad you guys said that, because that's exactly the direction we're kind of going in when we had internal dialogue about this. But instead of using the Post-it analogy, which is very similar to what we thought about here, was kind of like the refrigerator magnets with the words, and having people be able to then create their own pieces to that second half. So
right.
So it kind of it starts allowing people to see that their efforts in ending AIDS can look very differently, right? It can look very different. It doesn't necessarily always have to be about getting tested or getting treated. It could be about a plethora of other things that they could do to address the impact of how HIV is affecting the Latino community, right?
Sure.
Yeah, that's nice. I like that.
Good stuff. Is there any other feedback as far as the theme goes? Anything that you guys would... And I'm making note of what you're saying here, Alfredo, too. You said commit to 0 new infections, commit to make AIDS history, commit to end AIDS. And again, these would be translated in Spanish as well. So, I mean, the general theme, again, would be commit to blank, but people would have the option of filling in that blank to whatever they feel fit. So we would both role model it in the posters and also give people different options as far as what they could do for those fill in the blanks. Is there any other feedback people would want to give as far as how they think the general community will respond to that? Stephen Vargas just said, commit to raising awareness and encourage testing. So again, those are two good ones too, or they could work in tandem with one another where they're both kind of fitting into one. Commit to raising awareness. And again, similar to what we did last year, we would do a major push to have people kind of share this through social media platforms. So we want to have some way in which people can create something like this online and then share it on their social network platforms so that people can kind of have a heightened awareness of what's going on with the campaign and the theme. So again, maintaining the theme being something that's very action-driven and very concrete to allow the general community to see what they could do to raise awareness, to address the way HIV is affecting the Latino community. Are there any other comments? I think we've gotten some good ones so far as what the theme could look like here. Is it a general thumbs up as far as what people think? Is it working with people so far?
Oh yeah, definitely.
Yeah, I like it a lot, Tony.
Yeah.
Beautiful. What about the image? What type of imagery do you guys imagine or image going with this theme? Do you guys like the idea of having actual people? Because I know previously there's been times where we have, more drawings, more figurines, Last year we went back after getting feedback that people actually like seeing real life figures, real people. Do you guys like that? Do you think that people responded to that well?
Yes.
Seeing actual people rather than figures?
Yeah, I think
it looks very personable,
People,
and very authentic.
Yeah, I agree.
As much as I like the abstract and everything, I think it is much more effective when people see folks that look and sound like them. So yeah, I'll go with the real life.
That's good to know. That's good to know. I think one thing that I particularly want to see look different this year is I think last year's poster looked a little dark, and I think it might have seemed a little more fear-based because of that. So I want to make it a little lighter. Maybe changing the background or some of the coloring around it, just to make it look a little more inviting than having it be something gray, black and white. What do you guys think about that?
Yeah.
Good stuff.
I think it points in the right direction.
Yep.
I think it points in the right direction because you want to give the impression that this is working toward ending the struggle against the fight instead of looking like it's diminishing that fight, and kind of that move toward a lighter color certainly helps with the perception of that.
Are there any particular people or segments of the population do you think we should focus on? Because I know historically we've gotten some feedback. We've had some people say that they'd like to see trans individuals represented. Are there any other populations or subpopulations that you think that we should potentially try to target, or figures we should try to visualize, or you think the Latino community might relate to well?
I think it's youth is important to target that population. I mean, kids at that age, they are not identified themselves at risk. So how can we portray a youth group, probably, like we commit to? But
yeah. I agree. I think the youth are the ones that are more in the need for a real powerful information out there. And we, as Latinos, are more about family and about protecting the family. So I think definitely youth could make a bigger impact this time.
All right. So I'm hearing youth. I'm hearing family. Those are very good ones. I think it might also be good to kind of potentially maybe some sort of family visual rather than an individual visual might work too. I know Stephen just brought up a good point. We haven't really talked about undocumented much, which is a big portion of the Latino community, and I think a portion of an invisible portion, invisible segment of the Latino community that's really impacted by HIV and AIDS. But how would you guys imagine an undocumented person be visualized in an image?
Could be so many things, like getting in line, waiting to be paid along with everybody else. But I don't know how that could be portrayed. Because a lot of our brothers and sisters in the South are working in farms, and I mean, I'm not sure in other cases, but
I see that. That could potentially be a background.
Yeah.
Maybe a background of crops or a field of people.
Yeah. You know what? I see the images of the new movie Julio Cesar. Cesar Chavez, Julio Cesar Chavez, and I think it has a lot of good images there that maybe we can kind of piggyback on.
Yeah, that'd be good to have multiple ideas, bring that to the voting and drop it. Because that Julio Cesar Chavez is very expressive. I mean, it's powerful and actually changed many political aspects. It's great. But the new generation of immigrants is more no more farm, but more construction type, at least in the Southeast. So, and it's very difficult to portray someone without document. It's kind of a label.
Yeah, it's something that's very difficult, and again, you don't want to be stigmatizing either.
Yeah,
right.
Yes, that's the danger of that.
Because it could be anybody.
Yes, exactly.
It can be.
Yeah.
The one thing is that this is that when I just wanted to say that portraying an undocumented, it could be a touchy situation because any of the three individuals right now on the screen could be undocumented.
Mm-hmm.
Well, we're
I think
undocumented in a certain point in time. Yeah.
you know,
Right.
I think that we have to be careful in portraying certain image of what the undocumented look like. So if we portray a construction worker or a farm worker, we are saying that all undocumented are just farm
Mm-hmm.
workers, construction workers.
Yeah.
So we don't want to continue that image. Even among ourselves, we are immediately thinking about that, and that's not correct. So one of the a friend of mine who recently passed away, he was part of the legacy, the movement of Chicanos in the United States, and one of the things that he did, and it kind of surprised me, was that he was always wearing a T-shirt that saying "I could be illegal," and I thought that was a little bit out there, and just watching him wear that. He was never undocumented. He was a Chicano and born and raised in the United States, but he took it upon himself to wear that as a flag. And I always thought that it was controversial to wear that T-shirt. I always thought that also showed a lot of, I guess, it motivated a lot of conversation and encouraged conversation. And I think that portraying who could be undocumented, it could be a dangerous thing. And I say, if we would adopt his words on that T-shirt and put it in front of all these people on the screen right now, it does promote the same type of conversation. Is that who is an illegal? Is it just the construction worker or not? And many construction workers are not undocumented.
Right.
So that is the one thing that I just say, yes, we need to reach out to them, but we're reaching a population regardless of their status. And I think that the Affordable Care Act, and that is the unfortunate piece, leaves them out.
Oh, definitely. And trust me, that's a piece that part of what we want to do along with a series of webinars and things like this is we had webcasts last year, video webcasts with experts. Part of what I want to do is have a very candid conversation about this linkage to care piece and how much of that and who's left out, because oftentimes the biggest population that's left out are those people that are undocumented, which would then make linkage to care and retention in care even that much more difficult, which are those undocumented individuals. So I'm glad you brought that up, and I think you just shared a very powerful story, Edwin, so thank you for sharing that. I think it's definitely enlightening the way this conversation is going and the type of imagery that could be used.
Tony, for us that are actually living on the U.S.-Mexico border, the face of the undocumented has been changed for us by the arrival of women with their small children that they cling to as they are transported from one station to the other to get registered, as they are separated in order to get their information and get them into the different ICE type of settings, and then released to us in the community to help them regain humanity and try and do something about running away from violence. To us on the U.S.-Mexico border, the undocumented es nuestra madre y nuestros hijos. So I think it comes at a time where the face of the undocumented has been changed for us from the Cesar, the field worker that Cesar Chavez fought for, to the mom clinging to that child, looking for that child's future.
Yeah. That's a beautiful thing. That's very true. And again, I think if we portray a family setting or a family image that kind of portrays that, I think could potentially really speak to that. And I'm liking the direction this conversation is going in. This is very good information. Wonderful. Are there any other comments or feedback about anything we've talked about so far? If not, I thank you guys for lending your ears and your feedback. I think it's definitely helped greatly with the direction we've kind of had a conversation with internally and the way we can kind of solidify some of these details. You guys have definitely been a great asset, and I look forward to continuing this dialogue. If anything comes up that you think you want to have a more direct one-on-one conversation with me about, I would be very open to that. So by all means, please don't hesitate to reach out to me, and hopefully you guys don't mind either. But I'll try to do the same with you all. And again, I thank you all for your extended commitment and your continuous efforts. And if anything comes up again, my information, in case you don't have it, most of you guys should have my email, but my phone number is here, and this is my direct number. So if anything comes up, don't hesitate to pick up that phone and give me a call. And I look forward to speaking to you all. And again, there's a series of other people that will join us in the subsequent call before National Teen AIDS Awareness Day. But the next follow-up conversation will definitely be me either sending out an email or having a quick call where we kind of solidify the theme based on the feedback that you guys gave us today. So with that said, thank you. And I know we went over about half an hour, but thank you again for your time, and we'll be in communication. With that said, thanks, and take care.
Thank you,
Thank you, everybody.
Thank you.
Bye, everyone.
Thank you. Bye.
Bye-bye.
Thanks, Tony. All right, bye-bye.